are some foundational things that we know that are important for Alzheimer's
Yeah.
prevention, prioritizing exercise first and foremost, right? Obviously, sleep is so important, and we as a society tend to just kind of schedule our sleep around our life rather than scheduling our life around our sleep. And
Yeah.
so
Good point.
prioritizing that stress management, we should all do more stress management, right? Meditation and just like allowing your brain to take a break. Diet, of course, we want to stay away from those really highly kind of like high sugar and very processed foods, not good for anything. It's certainly not good for blood sugar regulation, which is huge for the
Hmm.
brain. And then making sure that you're taking a good multivitamin. And we have limited time, so I can only go into so much about the
No,
multivitamin.
go right ahead. We have all the time in the world. It doesn't
Oh,
matter.
okay, we'll be here for a while.
Welcome to the CoachMD podcast. I'm Dr. Charles Glassman, bringing you 3 decades of experience as a physician and a coach. Join us as we navigate the maze of medical advice with real-life stories, empowering you to take charge of your health. In our That Happens segment, guests share transformative experiences, reminding us that we're all human and not just patients. So get ready for a journey into healthcare reimagined, where empowerment and discovery pave the way.
Hey, it's Dr. Charles, aka CoachMD. In my over 30 years of medical practice, I made it my goal to help people create a strong mind, a healthy body, and an unshakable spirit. And that's why I launched the CoachMD podcast, because I wanted to give people a place to go where they could feel as though they're getting information that they may not be getting from their regular doctor, because we all know that conventional medicine, we need it, right? We need conventional doctors, but unfortunately, with the blinders that are placed on doctors' eyes, look, I was a doctor for over 30 years, so I know how it goes. And there's a lot of pressures, there's a lot of fears of malpractice and things of that sort, where you have to play by the company rules, the company line. You have to do what's been done in the medical community. But unfortunately, a lot of times it doesn't get people the care that they really need. And what I did was, in 2002, I became one of the first doctors in the country and the first in New York State to form what's called a concierge practice, a highly personalized practice where people could come to me and they know they're going to get the real deal. I'm not going to be worried about whether someone's going to sue me or whatever if I just tell the truth, what I really think is good for them. And what they could do, I'm not taking care of them. It's not my duty to take care of them, but to give them the tools to empower them to take care of themselves. And unfortunately, that's not prevalent in the medical community. A lot of times people will come to CoachMD podcast to listen to what my guests have to say, because they're not getting it from their regular doctors, right? They're not getting this. In fact, they're taking their health into their own hands and doing better despite sometimes their doctor's recommendations. So I like to have guests on my show that will give people information and tools so they can be able to live their best life from a mind, body, and spirit perspective. And my guest today, Alyssa, who has a company called Prescribe DNA, which is all about personalizing care. Now, people need medication. Okay, I'm not against medication when it's needed. Okay, sometimes it's really needed, but if you're going to take medication, you're going to want to know that that medication is going to be okay for you, is going to be right for you. So, Alyssa, thank you so much for coming on my program today. I'm so happy to have you, and your expertise, both your background in as a pharmacist, as a with a degree in pharmacology, and also with the drive and the foresight to start your own company. So I definitely want to know what that's like, but I do want to know, why you decided to launch Prescribe DNA. What was that about? Because I have a feeling, because it is precision medicine, what we're talking about, really individualizing medicine. So if you could tell us a little bit about that, I know my viewers and listeners would love to hear that.
Fantastic. Well, first of all, thank you for having me. I really appreciate it.
Yeah.
Hi, everyone. My name is Alyssa. I'm the founder of Prescribe DNA. I am a pharmacist by training, by education, and I'm board certified in psychiatric pharmacy as well as in nutritional genetics. And so my goal with starting Prescribe DNA started from a little bit of a one of those situations that maybe you didn't know it was meant to be until it became that, right? And
Yeah.
that was working as a clinical psychiatric pharmacist in a big hospital, taking care of some of the sickest of the sick,
Mm.
psychiatrically speaking. And so I didn't go the traditional pharmacy route. I've never worked in retail setting. I've been in hospital and clinical practice. And it was when I had my first son that the work-life balance came into question, and I started to have to, dig in and find out what is it that I really want to do with my career. And, I, as much as I loved the job that I had, and I felt like I was making a difference, and I loved the team that I was working with, ultimately, I didn't know that I was serving people at their highest level and at my
Mm.
highest level, because when you work in an organization like that, it's very much based on guidelines, and just kind of treating everybody according to the guidelines and treating them as one of the masses, and it didn't sit well with me personally. And so in digging into to do a little soul searching, or whatever you want to call it, I decided to pursue this kind of like off the beaten path um, area of a pharmacy, where I work directly with people to find their best medication and nutrition and supplement regimens based on their DNA and specific biomarkers. And through that exploration, I found out that I am at an increased risk of Alzheimer's based on a genetic risk, the ApoE gene.
Hmm.
And finding that out about myself, I went even further down the rabbit hole and learned that, you know, like I'm sure you could probably relate to this, is that, through professional school, you learn all about what goes wrong when Alzheimer's is apparent, right? Once the
Yeah.
symptoms start, and the problems, and like what do you do about it then? But we both know that's not going anywhere, right? And not in
Right.
our lifetime anyways.
Yeah.
And that the goal is really should be focused on prevention. But we are not taught about prevention strategies for nearly anything, but specifically for Alzheimer's. And so I work with people on a lot of conditions that are focused on brain health. But my passion in my area of focus really now has been using DNA and biomarkers to personalize a prevention strategy plan for people at risk of Alzheimer's.
I love that. Listen, I did not know that about, I really appreciate you sharing that. Yeah, so God, I mean, it's just such a coincidence in quotations, because the
Of
way I
course.
look at these things is, they are meant to be connections, and people that you meet in your life definitely are happen at the right time when our intentions are right. When our intentions are good, the right things happen for the right reasons at precisely the right time. And the reason why I'm saying this is because I was at an event over the weekend, last weekend, with friends of mine from high school. I hadn't seen them in many years. And one of my buddies from high school told me that his brother, who's 4 years young, was always the younger brother. He was always hanging out with us, and he became, a big football player and a dentist and a very successful professional. But he was the little guy for a while, for a short term time, until he became much bigger than me. But anyway, he unfortunately, their father had died of early Alzheimer's, and he was just diagnosed. That's why he retired from his dental practice of early Alzheimer's. And also, right around this time, I do some consulting work for a medical research lab that works closely with Alzheimer's Drug Development Foundation, and they gave us some information recently about some work that was done. And again, this is, we're not giving advice here, and this is not the end all, but it's right up what you're talking about is, Dean Ornish had done a study, and Dean Ornish was a cardiologist back in the 90s who famously published some studies in the New England Journal of Medicine that showed how taking a group of people uh, with um, angiographic evidence, which catheterization, where you shoot dye into the arteries of the heart, and they were documented to have severe coronary artery disease. He took this group, about 100 men and women, and put them kind of for a year. Now, I don't know how they did how they did this financially or whatever worked out. But anyway, the study was they took him for a year. They put him in an area, in kind of a pristine area where the diet was pristine. I think it was a plant-based diet. They were able to exercise, they were able to meditate. A year later, they did the catheterizations and they showed that their coronary artery disease, much of it had reversed. So Dean Ornish has done the same thing now with now when we talk about cardiovascular disease, the vascular system in our body, the arteries, it's the same everywhere. I mean, their blood vessels serve the heart, the blood vessels serve our legs and our extremities, but they serve the brain. So Dean Ornish did a similar study, and I'll send that to you, and I'll have a link on the description, where took the people and showed that there was I guess after a year, they were doing, you talk about biomarkers, and there's a test, now you're probably familiar, the Passivity test, and it measures certain biomarkers that measure amyloid, whatever. But anyway, it's just amazing how I had no idea that this is the work you were doing, Alyssa. I mean, I knew prescribed DNA. Yeah, it's beautiful because, I mean, this is a great fear for people. And just because you have the, ApoA4 gene, whatever, it's not a death sentence. It's not definitely that you get the early Alzheimer's. However, it is a wake-up call to do things in life that could prevent it. And as you're saying, we don't talk about prevention. We're a sick care industry. So all we're doing is treating people who are sick and not preventing them from getting sick. So now that you have this information, tell us, kind of like, someone comes to you, right? They sit down for a consultation and they say, I'm afraid that I'm going to get Alzheimer's. What are the next steps? Like, what do you do for that person?
Sure. And so I guess, it depends on how people have found me, through Facebook or something like that, or a referral in a lot of cases. First, I start off by finding out why, what is their reason for thinking that? Because truly, I mean, as we sit here today, both educated professionals who are taking good care of ourselves, you and I are at risk of Alzheimer's, right? Like,
Yeah.
if you have a brain, you're at risk of Alzheimer's, unfortunately.
Right, exactly. Yeah.
And the genes are not, as you said, the end all be all, right? So I
Yeah.
like to find out where people's source of their fear is coming from. What testing have they had done? If there's just a family history, what other risk factors do they have? I mean, we know things like diabetes and heart disease and high cholesterol and stress levels and poor sleep, and all of these things are risk factors for Alzheimer's. But once you find out the person's story, right? And because all personalized medicine approaches, the best type of functional medicine approaches always start with the individual.
Yeah.
And then once we've kind of figured that out, the next step is to gather the data, right? And so gather the person's individualized data rather than referring just to the guidelines or the big, kind of publications. We have to look at, who are we talking to, right? What are your risk factors? Because once we've isolated those, then, now we're talking, right? Now we can get down, we can kind of narrow it down to, are you at high risk based on your, fasting insulin or your homocysteine, what kind of cellular deficiencies of nutrients do you have? I'm hearing you talk about your friend who, I'm hearing he was a football player, so I'm thinking potential TBIs, right? And I'm hearing he's a dentist, and how much mercury has he been exposed to? And these types of things, start coming up with a personalized plan based on the person that's in front of me, rather than, treating people as if they're all just, one of the many. So.
Yeah, no, it's great because, obviously DNA is very personal because it's your DNA, right? It's your genes. And so, DNA codes for different proteins. So it's the proteins are the thing that are driving all of the functions in our body. And when Alyssa talks about biomarkers, those are the blood tests you get, right? You get your cholesterol done, you get the usual. You go to your doctor, you get your physical, and basically you're just going to get, an SMA 20 or whatever. You get 20 tests that everybody gets, liver function, kidney function, and you get the stamp of approval and say, okay, you're off, you're great for another year. I mean,
Yeah.
that's right. So there are a lot of other factors and a lot of other biomarkers. And as you're talking about the prescribed DNA, I know you, and I'm sure some people don't want to know that what their APO4E is, they don't want to know that, because that will put them at a higher risk, as you said, for early Alzheimer's. But on the other hand, these are all, it doesn't mean it's not a slam dunk. And the reason why prevention is so important is because there's a concept of epigenetics. And so epigenetics can turn genes on and turn genes off. And those can be passed along as well. So, it's an inherited. So as far as being a slam dunk is, oh my God, I have this gene, it's going to, I mean, there are some, that are like, Huntington's chorea, for instance, there are certain genetic diseases that if you have that disease, or muscular dystrophy or things of that sort. But when you talk about genes as predicting, then you get into a little bit of a gray area. Okay. And you do want to make sure that that you do get the whole picture. And that's why I like what you're doing, Alyssa, because you're giving the whole picture. You're not just saying, okay, you have this, you're going to get Alzheimer's disease. No, you're putting someone in and allowing them to live their best life, and not to every day, and not to be projecting so much into the future. So what are some of the interventions that you like, the natural interventions, and if there are pharmacologic interventions that you think that you've seen that, or that you might be taking yourself, if you don't mind sharing, if there are, that you think can help prevent Alzheimer's from what you've seen and what and what your education has told you.
Sure. So just to back up a little bit
Yeah.
regarding, I just want to kind of echo that sentiment, right? Is like genes are not your destiny, with rare exception, right? So
Yeah.
as you were talking about with Huntington's and those deterministic genes, there are well, three-ish deterministic genes for Alzheimer's. And those are like the ones where, it's those really just horrific cases where people start having symptoms in their 30s and 40s. And it's like that family kind of like uh, very long history of people having this very devastating form of Alzheimer's, and that's the deterministic one. The ApoE4, like you said, it's, so much is dependent on what you do, with your daily life and your epigenetics component when you have that ApoE risk gene. And so, as you said, some people say, I don't want to know if I have
Yeah.
it. And it always comes back to that education of, just because you have it doesn't mean you're doomed. And in fact, if you know that you have it, and that knowledge empowers you to become more proactive, right?
Yeah.
You're almost ahead of the game compared to the average person, because the average person doesn't have that kind of like fear that kind of keeps
Yes.
them. As a carrier of the risk gene myself, I know that it made a huge difference in my life, because now
Yeah.
I know I have this thing, and it creates an empowerment. Not everybody becomes empowered. Some people crumble under that kind of
Yes.
information.
Yeah.
And so that's a conversation I always have to have with people, as I'm sure you can imagine, doing
Oh,
any type
oh
of
my
genetic
goodness.
testing. There's a
Yeah.
lot of signatures involved and a lot of, formal documentation being involved. With that said, so you asked what interventions can you make? Of course, I have to say that's based on the person, but there are some foundational things that we know that are important for Alzheimer's
Yeah.
prevention. Even without having an ApoE risk gene. And that's going to be prioritizing exercise first and foremost, right? Those creates all kinds of positive effects in the brain, from the BDNF and lactate and clotho, right? As some of the more emerging studies are showing that
Mm-hmm.
protective elements based on exercise. Obviously, sleep is so important, and we as a society tend to just kind of schedule our sleep around our life rather than scheduling our life around our sleep. And
Yeah.
so
Good point.
prioritizing that's when your brain gets cleared of all of that nasty kind of protein that builds up through the day. And so you got to focus on sleep. Stress management. We should all do more stress management, right? Meditation and just like allowing your brain to take a break. Um, Diet, of course, we want to stay away from those really highly kind of like high sugar, very processed foods, not good for anything. It's certainly not good for blood sugar regulation, which is huge for.
Hmm.
And as far as supplements are concerned, there are some foundational things. First and foremost, I think we can all agree that omega-3s are important, right? To get that
Hmm.
good, the DHA for the brain. And so even if you don't have the risk gene, getting a good fish oil, or even some people can use an algae-based form now that that
Yes, my
for the
wife
brain.
does that. Yes.
Yes, right? And it
Yeah.
still has that good like DHA,
Yes.
specifically, EPA is good for the heart health, but DHA is really where it's at for the brain. And then making sure that you're, taking a good multivitamin. And we have limited time, so I can only go into so much about the
No,
multivitamin.
go right ahead. We have all the time in the world. It doesn't
Oh,
matter.
okay, we'll be here for a while then.
Right.
Focusing on making sure that you have a really good quality multivitamin that includes the active forms of the B
Mhm.
vitamins. And then I like to pair that personally with a micronutrients test. It's not so you're not just guessing and kind of like, throwing spaghetti at the wall, right? Like
Yeah.
how much B12 do you have in your cells? Right?
Yeah.
Because as you were saying before, your doctor is doing some tests. And if you have a really kind of like forward thinking practitioner, they might be collecting a B12 level, for example, right? But it's checking your serum or your plasma level and is not necessarily checking the B12 level. And we
Yeah.
know that we can impact that based on your genes and the different B12 forms that are available. So those are some things that I think about. As far as pharmacologic, the things that I talk to my clients about, the pharmacologic regimens would be managing your blood glucose, right? So if someone has diabetes, or if they're, trending that way with the pre-diabetes and stuff like that, if it turns out that, they're more comfortable with adding a pharmacologic intervention rather than doing the hardcore like lifestyle modifications
Right.
because you have to meet people where they are, right? So if that's the case, then absolutely, let's talk about that. Let's make sure it's appropriate for your DNA as well. And then also the cardiovascular risk, because we know what's good for the heart is good for the brain. And so if people have that particularly, nasty form of cholesterol that is problematic, then we could talk about cholesterol medications, again, making sure that it's suitable for the DNA, but also making sure that it's not potentially causing additional damage to their brain. A lot of people, the statins and the brain fog kind of situation. And so we can
Yeah.
test for that and make sure that you're not at an increased risk of statin on your brain health in the long term. So that's just kind of the broad
Yeah.
view. There's a
That's
lot more,
great.
but well, I'll try to put a pause here.
Yeah, no, that's great. Love it. Yeah, that's a good, I'm glad you brought that up because that's kind of a controversial area with the statins. Because cholesterol is the basis of every cell in our body, and especially neurons in our brain cells. And there's been a lot of talk is that, what are we doing? We're winning the battle, but we're losing the war. So yes, it's in a sense, it's kind of like treating cancer. So early stage cancer, I'll use breast cancer as an example. Many women are scared to death by their doctor to go all in. So if a woman has a stage 1 breast cancer, which is a lesion that's less than 1 centimeter, it hasn't spread outside, there's no lymph node involvement, it's localized, and it's less than 1 centimeter, those are um, a, a stage 1 breast cancer. And I can't tell you, or DCIS, ductal carcinoma in situ, which is not cancer, which many doctors tell patients, women, that it is cancer. And so many women, they will say, just do whatever you have, do whatever you can, doctor, just take it out. And I speak from experience because my wife had that. And luckily, fortunately, I'm her husband, and this was 20 years ago. So, and she's doing fine. So basically, when that happened, we went to a friend of ours who was an oncologist, but she was going into functional medicine. And so you have to be careful though, because just because someone's a functional medicine doctor doesn't mean that they're going to do the right thing for you or recommend it. So here, this was an oncologist who went into functional medicine, and we asked her, what would you do? And she said, oh, I'd get a double mastectomy. Okay. And this is my wife didn't have any genetic predisposition to cancer, at least that we knew of. Okay. And she had a small tumor, which is curable by resection in 86% of the cases, and with radiation, 92% of the cases. And so we asked, well, what would you do if you didn't get if you didn't do the double mastectomy? What would you do? And she said, well, I probably would do chemo. Really? And this is going to functional medicine. Really? So if you get chemo, what does that percentage look like as far as increased cure rate? Well, it'll get you from a 92 to maybe a 94%. So if they're emitting to only a 2%, you know it's not any, because that's within the realm of error. And I don't know what studies. Okay, so all good. We said, well, it doesn't sound right to us. Do you have another doctor we can go to? So she recommended a doctor at Sloan Kettering who apparently specialized in holistic treatments, but also went over to to chemo when it was necessary or whatever. So we met with him, and we sat with him, he sat with her, and then the two of us were together, and he said, well, I said, well, what would you do if this was your wife? And he said, well, I'd blast her. We're like, what are you talking about? He said, well, I would do the mastectomy. I mean, I would do the lumpectomy. I would do the radiation, and then I'd give her chemo. And I said, really? And so my wife said, well, won't I lose all my hair? Because we had young kids at the time, and she thought it would be very dramatic and it would be totally upset everything in our family. And he said, well, the hair will grow back. It was like, that was it. He dismissed it. And so then when we were leaving, I see he had his whole waiting room with people in lounge chairs, but with IV drips. And yeah, there was some trickling electric waterfalls and some nice music. And he was really into Tibetan sound and for relaxation. So there was a lot of that going on. So that was his shtick, right? That was his shtick. So I realized that's, even though, it's people have their own bias, and and doctors certainly have their own bias, and they're going to steer you in a direction that fulfills their bias and not really personalized for you. So to make a long story short, my wife had elected to have a lumpectomy and radiation, and thank God, 20 years later, it's fine. So didn't take tamoxifen either. Okay, well, that was another one, right? So it was a lumpectomy, radiation. The lumpectomy alone would be cured 86%. The radiation would increase it to 90%. The tamoxifen, 92%. I mean, this is ridiculous. And then the chemo, 94%. I mean, really, you're going to upset your whole life and get all those kind of side effects. So, I bring up that story for a lot of reasons. One is that you can't always trust the doctor, what the doctor's telling you, because they are, actually, I'm sorry, I missed the key point. The doctor in the city at Sloan Kettering said, we have a cookbook for what you have. Okay, so talk about the protocols that you said, and that you have to go, we have a cookbook? I mean, this is cookbook? Okay, then that was the lumpectomy, the radiation, the chemo, followed by the tamoxifen. That was the cookbook for her, right? But my wife wasn't a cookbook, and we approached it this way. I'm not saying that's the way you do it for everybody, but, and I'm not saying that, what I'm saying is the way every individual, and that's what you're doing, Liz. And that's what I see is that you're looking to individualize the person who comes to you with this, and you individualize it with so the prescribed DNA. So what is that test that you do? What is it checking for when you send somebody I know you're doing the biomarkers, which are blood tests, and also the DNA, I assume, is a blood or a saliva test. What are you checking for with the with that, the prescribed DNA?
Sure. So there's a range of
Yeah.
tests, and so yes, if the two components would be the biomarkers, which is kind of said before that this is what your doctor is checking, and I like to, obviously we can't ignore those kind of basic blood
Oh,
biomarkers. We
sure.
take that, right?
Yeah.
But then there's more we can do, right? As far as checking LP little a, checking ApoB, homocysteine, these types of things, micronutrients down to the cellular level, omega index, that sort of thing that your doctors or, most of them, unless they're really, maybe even have an independent practice and they can, you know, uh, do this outside of having to worry about practicing under their umbrella, all right, of their healthcare organization. And there's all kinds of, red tape involved there.
Yep. Yep.
So there's that. And then the genetic component is there's a range there as well. And so it can go from something kind of, I mean, I think of it as basic. Probably most people would say it's pretty in-depth is pharmacogenomic panel, which is just looking at your genes for metabolism of medications. So your cytochrome panel. And as you were talking about tamoxifen, I was about to jump in and say, oh, if they started tamoxifen, did you get your pharmacogenomic panel for your wife there, making sure that tamoxifen is going to be effective? But so that's kind of one option, right? And that's for helping people navigate their medication selections based on their DNA. The
Yeah.
other would be the nutrigenomics panel, which is more about nutrition, lifestyle, supplement regimens that you can get tailored to, right? And then the additional genetic information includes those Alzheimer's risk factors like the ApoE and that sort of thing. And there are some protective genes, B, D, and F and that sort of thing. And so when you combine it all together, oh boy, have you got a plan for somebody, right? So you get
Yeah.
all of that information and you just know the person down to their DNA and can really help guide them, not only in their decision making, but also in the support and accountability and that kind of like coaching, right? To the CoachMD, right? Like that's a
Yep.
huge part of it because as you were saying before, like we have more information than any of us, even the smartest one of us, could possibly get through, right? The information is just coming out of every,
Mm.
you know, and yet here we are. Why are we doing so poorly as a nation? And the answer may be, I mean, I'm only supposing here, is that it's because there's not that like accountability and coaching aspect because you're only seeing your doctor every, twice, maybe a year, once a year, and you're doing this kind of superficial evaluation and they're treating you like the masses and it's all guideline this and guideline that. And, out the door you go. And so people really need, help, clinicians like us to help them to not just know this information, but then to implement it as well. So,
Right.
and then when you get their DNA information, it's kind of magical, frankly, that the buy-in or the empowerment aspect from the clients or patient's perspective is
Mhm.
so much more, and there are studies to support that, right? If you can give people a genetic basis for why they should do these things, they are so much more motivated, they're so much more inclined to follow the recommendations, and then you just help them and support them along the way.
Yeah, and what I found in my practice and why I had the personalized practice that allowed me to spend time with people and became Coach MD because that's what I felt I found myself doing more coaching than actually the MD part, right? I mean, it weaves in together, of course, but yeah, there's so much information out there. So people, if they have a condition or if they have a family history of something, so many people come in with information to sort through. And we know that doctors a lot of times don't listen to that, right? So here's this is the classic, and I'm gonna do a little translation, doctor translation, right? So a patient comes into the doctor and let's say they have family history of Alzheimer's, and they're going to say, I have the ApoE4 gene, and I read this study um, about prevention, about lifestyle, and these studies that if these nutrients that might be helpful, the omega-3s and some of the B vitamins. And I heard about clotho and anti-aging, and and the doctor is going to say, well, there's really no good studies that support that.
Yep.
So the translation is, I don't know. So this is doctor speak, okay? But the translation is, I don't really know what you're talking about. I have no clue because I have what I read in the New England Journal of Medicine, which is all sponsored by the pharmaceutical companies, the studies, and they really, have told me that, you have this and that, and so you need this drug for that. So there's really no studies that support it. I think you're kind of a little crazy, and yeah, so they may not say all that, but that's what they're thinking when they say there's no studies to support it. So we know, right, Alyssa, that there are studies to support this stuff,
Mhm.
and and so I use an example of, let's say, fish oil. I mean, every doctor now, fish oil and vitamin D. I mean, so that's not a controversial so much because now every doctor's an expert. Oh, your vitamin D is deficient. Okay, that's common knowledge. When I was doing it back in the early 2000s, or talking about how people should, and I'd like to talk a little bit about the proton pump inhibitors a little bit and the dangers, because I started kind of signaling in my community about that, and I was being laughed at by the gastroenterologists. They thought I was a quack, that I wasn't prescribing these medications, and but the fact that when you're talking about getting back to the pharmacogenomics, when you take a medication, most medications are processed in the liver, and liver enzymes are responsible for breaking down that. So if you don't really know how it's a one size fits all is not really the case, because somebody might need a half of a medication to get the same effect, and somebody might need twice as much to get the same effect. But we treat everybody as a cookbook, right? And as that. So yeah, so yeah, if you could maybe comment a little bit about that, about that, how we, treating people cookbook, especially with medications. And also, if you have anything to say about the proton pump inhibitors, which are the acid reducers. I mean, they work. Okay. If you have heartburn, they work. But uh, look, I'm not anti-pharmaceutical company. Don't get me wrong. I'm not, like people say, oh, you're anti-vaxxer or whatever. No, don't put a label on me as anti-pharmaceutical or whatever. I'm just telling you that their business is like any other business. They have to make a profit. They have to do, and they're going to do what they have to do. So they provide a lot of good funding for really great studies that have really helped us in so many ways, but in a lot of ways they've hurt as well. And one of the ways, I think, is when it's labeled that certain conditions, common conditions like heartburn, are a risk factor for cancer. So if you hear that, oh my God, I have heartburn. Oh my God, I'm a risk factor for cancer. Then everyone's going to, cut my heartburn 100%. And that's what the PPIs do, the proton pump inhibitors, the Protonics or the Prilosec or those kind of medications. But anyway, do you have anything to say about that,
Yeah,
Alyssa?
there's a lot to unpack there. So,
Yeah.
you kind of started it off as saying, I just wanted to point this out. It's like you
Yeah.
said, practitioners and like the vitamin D and the fish oil thing are not, like, that's pretty well known. I mean, this is a thorn in my, I can't tell you how many people, come to me and they, haven't even had a vitamin D level. I'm looking at their
Oh,
previous labs and like they haven't had a vitamin D level, or they've had a vitamin D level and it was within the normal range, right?
wow.
Of like
Yeah.
30, right? And so like they
Yeah.
heard the vitamin D level is 30 and they're like, oh yeah, that's, it's normal. And like
Yeah.
there's a difference between normal and optimal, let's get you up to the optimal level. And
Yes.
you mentioned OBGYN as well. I'm still just floored at the OBGYN community and general practitioners out that, for the clients that I've worked with who don't advocate for fish oils and omega-3s, who
Mm.
aren't saying, I mean, I even talked to someone who had a cardiac, and their cardiologist told them, don't worry about that. Don't worry about the fish oil. You got your medications, you got your prescriptions, you'll be fine. And it's disheartening, but that's what we're here
Yeah.
for, right? And so, okay, that was my own little soapbox there on the
No,
omegas and
no,
the
thank you.
omega-3.
Yeah.
But for proton pump inhibitors, so there are there are studies, right? We can say that
Yeah.
about the potential link, whether it's causal or correlational, right, on dementia and that sort of thing for people. So first of all, there are some conditions in which I would say to somebody, okay, you might need to be on a proton pump inhibitor. There, sphincter issues or Barrett's esophagus, that kind of thing, or if they have
Hmm.
history that would warrant that, then that's a whole other conversation. But for
Right.
the most part, what you see, and as I say this as a pharmacist, what you see is somebody was started on a proton pump inhibitor 10, 20 plus years ago
Hmm.
for just run-of-the-mill heartburn.
Yep.
And they have since went to other doctors and other doctors and other doctors throughout their life, and nobody thought to remove it because they didn't start it. Because they weren't the practitioner that started it, and so they're just gonna leave it alone, and they'll just keep
Mm.
adding to the medication list. And, we know now that there are risk factors associated with it, not the least of which is, impacting nutrient absorption. So when you
Yep.
alter the pH of the stomach, right? Like, yeah, it works. It will sure stop your heartburn. It's going to do a lot of other things and, take out with the action there. And so, getting if someone must be on it, making sure that their DNA is fit with the right proton pump inhibitor if they need to be on it, and if they don't, really helping them to see that, a couple of lifestyle modifications can get you that same heartburn relief once you get past the kind of like taper schedule, right? Because it can be
Yeah.
problematic with stopping those medications after decades of not
Yes. Oh my
having
goodness.
gastric
Yeah. Yeah.
secretions, right?
Yeah.
And then repleting their nutrients that they've lost because once have altered the gut pH that way, you're just not absorbing them well. So you can test for the nutrients, you can replete all of those and gradually help people to get off those proton pump inhibitors, and so that they don't go another 10, 20 years with this old medication on their medication list and nobody's double checking it. So
Yeah.
that's my 2 cents on that.
Yeah. I love it. And see, you could, if a doctor's open-minded, you could work with their doctor because
Oh, absolutely.
yeah, because
Absolutely.
I know that in my career, I'd rely on pharmacists. I'd always listen to pharmacists if they give me some advice because I know my roommate in medical school was a pharmacist. Okay. And he knew so much more about the biochemistry. We learn biochemistry in medical school in a semester, but as a pharmacy school, that's what you're doing. And the medications and the interactions. And now you have another layer here with the pharmacogenetics that you can really parse out certain medications. So I think it's important for my listeners to say that to their doctor, look, I have a relationship with a pharmacist. I would like you to have a conversation with the pharmacist. And that's why it's always important to either advocate for yourself as a patient with, do your research, bring it to the doctor. And if the doctor says, like I said, oh, there's no studies, well, actually, there are studies. With all due respect, I have them here. You don't have to read them right now. But it's also, I remember I used to, the pharmaceutical reps obviously used to come to my office as a doctor with their medications. And I had such a great relationship with them because I respected them and their knowledge because they knew their lane. So they were responsible for one or two medications. I have to keep in hundreds of medications in mind. They know they're one or two. So I would listen to them and learn from them. And I think it's really important that if your doctor, see, one of the couple things that you can, that I would suggest that if a doctor is not listening to you or is reluctant to speak with somebody on your behalf, like a pharmacist, like Alyssa, who, found that you have all these things and, if they're not, that's a red flag. You want your doctor to be open-minded because they need to be serving you. Okay. You're not, if you feel like you have to take care of the doctor's feelings or their ego, the first time you have in your head that, oh, I don't want to hurt his or her feelings, or I don't want to challenge them. The second you have that thought, you either have to step back and say, I'm not going to do that, Or if you don't feel you could do that, you got to get another doctor, because you shouldn't have to feel, yeah, that's a big red flag, right, Alyssa? I mean, I'm
Yes.
sure you deal with doctors all the time, I'm sure, and different personalities, different, is it, what's your reception like? Like when you do these panels on patients, and are they, do they share it with their doctor, or are they a little bit afraid to do that, and they just kind of keep their relationship going with you, and their doctor thing is over here? What's does that happen?
So yeah. So there's two kind of thoughts that I have with regard
Yeah.
to that. One is, from the patient's perspective, um, or from the doctor's perspective, I should say, it's really not, and I hate to use the word fair, right? Because this is not kindergarten, but it's really
Yeah.
not fair to show up for your annual visit and kind of unload like, oh, I got all this testing done, and here's all this stuff, and here are all these studies, and they're like,
Yes.
whoa, 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 like I have
No,
another
agree.
person in
Totally
15 minutes.
agree.
Like,
Yes.
you have to be respectful. Yes,
Yeah.
that doctors are working very hard. They're working
Yes.
very hard, and their
Yes.
burden is more so, I don't tell you, right? The
Yep.
documentation, all that. So if you're going to have a conversation above and beyond what you scheduled your appointment for, make sure that you're, scheduling that, sending information in advance. There are a lot of
Great.
electronic means of communication. If you're going to be requesting additional labs that that they've never tested before, send them a message,
Yeah. Great
get that
advice.
communication going so they have time to process it, about it, look into it in advance so you're not catching them off guard. The
Great
other thing that I
advice.
would say
Yeah.
is I actually thank you.
Yeah.
It actually works very well because doctors
Yeah.
are just regular people, right? And they're doing their
Yep.
job, and for the most part, they really want to do it well, right? And you
Yes.
can help
Yep.
them. It's supposed to be a partnership.
Yep.
So, the other thing is that I actually have really good reception from the practitioners when I make recommendations because, first of all, I have years of experience of working, directly with physicians in my previous life, if you will, as like working in hospital and working in the psychiatric hospitals
Mm.
where I am going around, I'm attending rounds, I'm working in partnership with practitioners. So finding your, if you're going to go out and find your pharmacist partner out in the world, make sure that they have, some really good solid time that they've spent in working with practitioners so that they understand the burdens that they have and how they can best help, because it's not helpful for me, if you were in your office on a Monday and I sent you this just like
Right.
gigantic file on this person and just gave you a bunch of information, and nowhere in there did I include what my recommendations are or what to do, you'd be like, why are you
Yes.
burdening me
Yeah.
with all this information on a Monday morning, right? Instead, my method of communication is, first and foremost, this is your patient, and I see that you've done all of this, but here are my recommendations right on the top, bulleted, very simple, very straightforward, couple of sentences, and then if you want to learn more about why I'm recommending this, here are all my supporting data, right? And so sending that to them, and they have found it helpful, and I have,
Yeah.
I mean, I pretty
Yeah.
close to 100% success rate in getting my recommendations switched over for people, because I come at it from this very respectful, collaborative standpoint with the data that's almost inarguable. So, and if
Love
people
it.
don't, want to include their practitioners for things like supplements, all that kind of stuff, then that's their own free will. Everybody's got their ability for supplements and things like that to do it on their own. But I, of course, advocate to include your practitioner, because you're really going to get the best bang for your buck, if you will, by
Yeah.
having a full team of people surrounding you.
Yeah. Love that. Great advice, because yeah, I mean, a lot of times, I mean, with the route I took in my career, I definitely caught the brunt of sometimes negative opinions of other doctors, especially when I did the concierge practice in 2002, which was again way before the curve of personalized medicine and such. And many doctors in the community turned against me because they felt whatever, for whatever reason they turned against me. Not everybody, but there were some. There was one doctor who we referred to a lot, and instead of supporting us, they put in their waiting room those patients of mine and my partner at the time. If you're looking for a new doctor, we'd recommend this doctor. Okay. Instead of encouraging them to stay with us in our personalized practice where they had to pay a little bit more, they immediately, because they didn't want to lose the referrals of a large amount of patients, wanted to refer them to doctors who would refer to them, right? You would refer back to them. So they didn't want them to go to doctors who didn't refer to them,
Sure.
because we were big referrers and they didn't want to lose that. And I can understand it, but so I kind of, I don't get the idea that I'm beating up on my colleagues at all, because I'm, one of the reasons why I left what I was doing is because of the stress, and most doctors couldn't leave and do my concierge practice for a lot of reasons. And so I don't mean to sound like I'm beating up on doctors, but again, my role is to advocate for patients, but it is, for taking that information and laying it all, coming in, I would shut down if I had 20 patients in the waiting room, and I was running an hour behind, and a patient came to me with opening up a list of 10 different things, or, oh, I went to
Oh,
Alyssa, I went to Prescribe DNA, and I have 10 pages of this here. I want you to look at this. Meanwhile, I gotta be in and out because 20 people are going to be screaming at me in a few minutes, right? So what you're talking about is a really great approach. So make a dedicated appointment to discuss it, send him any information ahead of time, and your report is so respectful, because that's what I think you're right. If a doctor says, here's 6 things that I'm recommending here, right at the top, whether they, read it or not, your company's name, you're a licensed pharmacist or pharmacologist, and you have all the credentials, so they can trust that. And I think that, yeah, that's good at getting things done, because that's the bottom line. You want it's results. That's what we want. That's great. I love that.
yes, absolutely, right?
Yeah.
Yes.
Yeah. Good
Yes, we got to
job.
focus on the client patient getting their result, and it's not helpful to just kind of keep them in this limbo state, right, where they're not getting any better. We have to make traction, because time is our biggest asset or our biggest enemy if we're not using it correctly, especially in the fight against Alzheimer's, right? It's like
Yeah.
we know that there's limited time, and so always keeping things moving forward, being very actionable, and getting results.
Yeah, awesome. Well, listen, I thank you for, sharing all your information and coming on the Coach MD podcast. I really appreciate it. I know my listeners and those watching this podcast got a lot out of it. And I will, in the description, I'll put, the links to how they can get in touch with you and your company, and some other information, some other useful links. And, thanks again. I really, really appreciate you coming on today. Yeah. So I'm going
I
to,
really appreciate you having me. This has been
yeah,
an
thank
absolute
you.
pleasure.
Thank you. So I'm going to wrap it up on the Coach MD podcast. And as you know, I'm Dr. Charles Glassman, AKA Coach MD. And as I do always, urging you to stay strong in mind, in body, and especially in soul. Bye for now.